All right, guys, welcome back to W.D.Y.D. CSP. Do you do the central stir processor? All right, guys, beautiful ortho loaners, much different than in-house ortho. Ortho loaners are a whole different breed. So let me show you how to process ortho loaners. Okay, so let's get into it. All right, guys. So ortho loaners, you definitely, whatever your process is in your facility, is you want to check them in, right? Put them into the system if you have a system tracking system for it, and of course for specific trays, you want to go ahead and take this tray apart. Now, for any of you guys that are familiar with with this company mini frag and the mid-foot 4-foot tray. You know, it has nice little compartments there and a lot of components, a lot of instrumentation. All right, so let me take this loaner tag off, this vendor tag off, where they put the name of the tray, the description of the tray, their contact information, and what vendor dropped off this tray. All right, so I went ahead and got my instruments out of there. I'm looking inside of the tray for any bioburden, any debris, any kind of damages. And let's be honest, man, loaner trays, these things look like they've been dragged down the street and they get pretty beat up, right? This one actually has a housing for instruments, so that's why I didn't flip it upside down. Little mat there. All right, so I'm gonna go ahead and inspect these instrumentations. The beautiful thing about loaners is that there are no count sheets, right? At least some facilities, many facilities don't do count sheets. They usually take a picture of the tray so that they know what was in the tray and like separate the layers. But a lot of the facilities I've been to don't do count sheets for their loaner. So we just need to inspect for cleanliness and damage. So we don't really function test their instruments really. I don't do tap tests on them because we can't replace them. We just inspect them for cleanliness because in all honesty, man, with loaner trays like that are this big, really, they don't even use all these instruments, man. That's one of the things about loaners that I've never really understood is that you have these really, really complex trays, and the majority of the items in these trays aren't really used. All right, so I'm gonna go ahead and that layer is already inspected. Place an indicator on that layer there. Go on to the next. All right, so looking under my lighted magnification here and checking out these instruments here. Now this instrument here, these drill guides, you want to look down the lumen there, but these are the ones with the little springs. You want to open that up because this is where most of the soil and bioburden occurs, right? And there's usually a little spring that's attached there to help this out. Now this one doesn't have a spring, so I'm gonna put this back together. Actually, was this the one that had the spring? Yeah, that one did have a spring. I'm sorry. So looking in there, it's this next one here. I believe I took it apart. It didn't have a spring. Yeah, that didn't have a spring on there. There's usually a spring that's in there. There's supposed to be a spring in there. Without that spring, that drill is useless. Now this one's pretty tight. I'm pretty sure nobody took this apart in decon. This one, I can almost guarantee that this is going to be bad. You see that, guys? Yep. That drill bit is dirty. This tray is done. This whole tray is going back to decon, so I'm going to put this back together, place it right there in the top, and just send it right back to decon for cleaning. Now I'm going to work on the second tray here, guys. So, all right, this is the second tray in this loaner order. So let's go ahead and again take this tag off and disassemble this tray, and let me show you how a loaner tray is processed. All right, again, multiple layers in this tray. I'm taking off the tag, placing the tag off to the side because I'm going to need that later for my wrap tray. All right, couple different components inside of this tray. All right, and then right there on the side we have a couple modules in there. All right, so I think 3 or 4 of them. Yep, 4 modules. All right. Of course, we want to inspect the tray for cleanliness, for any damages, for some leftover indicators, because let me tell you, sometimes people like to skip steps when cleaning loaners, so you want to make sure. That's the whole purpose. So this tray don't look too bad. This is not a bad looking tray. This one hasn't been beat up lately really bad yet. Excuse me. All right, but you got your little 4 modules and your little inserts there. All right, so let's go through this inspection stage. So I was going to put it in and then take everything out, but I'm going to show you the right way to do this. All right, you're going to take everything out of this container because it's easy to take this out, right? And of course, inspect the bottom of that container. There you go. Set that in place. Okay, check the instruments out real quick. All right, I have the second one. Inspect that through. I'm not going to lie, guys. I've already inspected this tray prior to this video, so you see me almost just put the instruments back in there, which I forgot I was doing a video. So that's why you saw me just trying to put the stuff back in there, because I've already inspected this tray. And I already know that it's good to go because the last one was dirty. So I was like, wait a minute, I'm not going to do this video and then wind up having another dirty tray on the video because it's going to kind of piss me off. So I've already inspected this tray. So I'm just trying to show what I did for the video purposes. So I apologize if it looks like I'm skipping steps or moving a little too fast. But I'm going ahead and back these things out again. And there's a little spring in there, right? You want to make sure that that spring is locked into the collar, right? So that one there didn't have a spring. So I'm going to go ahead and write on a blank label that that drill guide did not have a spring. If you have backup springs, get one, put it on there, guys. But you know, I'm not sure where that spring was lost at. I don't know if it was during the decon process or if that spring was lost prior to us getting that tray. It's a shame we can't verify prior to receiving our instruments. These loaners that all their equipment is actually functional, not broken, and has all the components needed, right? So we kind of find out after we clean everything. So again, these drill guides are usually really tricky. You want to make sure that you're looking at the cannulation. If it comes apart, come apart and make sure that they took it apart in decon and cleaned it correctly. Now, each of these modules can have a lot of instruments in there, right? So these modules are really compact. The drill guide is another instrument that you want to take apart and inspect very thoroughly because that's another one that can be pretty dirty if not taken apart and cleaned manually correctly. All right, taking all the rest of the components out of this tray. One thing you don't want to do with loaners, if you notice, I'm taking them out of the slot one by one. And you know something that's kind of contradictory to what the IFU states. If you look at the IFU to most loaners, in order to clean their instruments, this is another instrument that you need to take apart. There's a spring in there and a couple components. So important to take that apart in decon for proper cleaning, but also important to inspect it properly over the prep and pack side. So as I was saying, you see me taking these instruments out one at a time, but it's contradictive of their IFU because their IFU states that you cannot clean their devices in the sterilization tray provided, and those are the sterilization trays. You have to take all those instruments out and place them in another container in order to clean them. But can you imagine taking all these instruments out, put them into a basket for cleaning, and then trying to match them up to put them in the right module? Man, that would be so time consuming. And that is why these trays are never properly cleaned in decontamination. They are sent through the washer in this sterilization container with the lid closed, sent through. Now, when you start taking stuff apart, guys, just make sure that you know where you took it off. So take your time when you're doing trays that are this complex. Do not just take all your instruments out without thinking and just spread it all over the place, because you're going to have a tough time matching that up. All right, so indicator on the top there. Start working on these modules. Now, these modules have a little take apart inserts. Okay, and then there's layers in the bottom of it. So let me show you what that looks like. So a little instrument there, some implants there, or some trials. So you want to take the instrument out. You want to inspect the instrument. Okay, and this one had like a little small area that was hard to see with the naked eye. So you want to go ahead and put that back in, and then grab each one of the little trials or implants that are in there, right? And inspect them for cleanliness. Okay, but again, you notice that I'm taking them out one at a time, not just dumping them all out onto the table, or taking them all out and placing them on the table to inspect later. Again, to take all these out all in one shot, it would be super time consuming to try to find everything back. Because again, first of all, the item numbers are printed on those instruments, but some of them are so small that even with this type of magnification, those numbers are extremely difficult to see. All right, working on the next module. And you also notice I didn't put an indicator inside of that module. I'm going to tell you why in a few seconds after I start organizing and playing with this. Now, this instrument I've never seen before, so I'm trying to figure out how it opens and closes. All right, and I just figured it out, so I'm like, okay. And I'm one of them tinkerers. I have to figure out how an instrument works, because again, it's like that's part of our job skills, right? We need to know how these instruments function, how to open them, how to close them, because how else we're gonna know how to clean them, right? How else we're gonna know if something's wrong with it? Okay, again, taking out each one of those loaners one by one, making sure that they're clean, and place them right back to where I got them out of. Again, you don't want this. Again, if you've ever played with one of these trays, you do not want to take all this stuff out. Some of these trays, now not this one specifically, but the one I sent back to get cleaned, that has over 700 instruments in it. This one's right there because it has, I'm going to show you one of the caddies for the little screws. So it's just about right there too. All right, guys. So again, taking those loadings out carefully. Yep, taking those little instruments out carefully there, making sure that I don't drop them. Making sure that I'm putting it right back in the correct slot. Because if you've ever dropped a caddy with implants in it, man, you do not know the level of stress now, do you? You would know it, right? If you ever dropped a caddy with some screws or implants in it, that stress level is up there. All right, finishing up with this little caddy here. Sometimes it's easy to grab the little tool used to remove these out of the tray rather than trying to pull them out with your fingers, because they can be kind of tricky, right? Okay, we're going to go ahead and put this lid back on. And then we're going to set that inside of the tray there. Again, no indicator in there, right? All right. Well, this is the one I'm telling you about, guys. Screws. This is the one that is like the nail biter, and you got to be very, very careful. I'm going to tell you right now, guys, when you pick up a screw module or a screw caddy, don't attempt to pull any of those screws out. Do not play with these screws, because first and foremost, if you're not familiar on how to measure these screws, if you're not familiar with the type of screws that they are, do not try to take them out. Just inspect them, look for cleanliness, and leave them things alone. Okay, don't flip it, don't take it, don't even pick it up off the table with that lid removed. Oh man, let me tell you, that's a nightmare. You want to go ahead and put this lid back on, just like so. And once the lid's on, then you can turn it to the side or upside down and look, inspect for cleanliness as well. For those individuals that put indicators in those implant trays or implant modules, oh man, you should be smacked in the hand, guys. You shouldn't do that, because those indicators break up and they get caught up on the thread, and there's a problem. All right, so we got some cannulated reamers here that we're going to take over to our, you want to make sure now you can either flush it, or if you have a borescope like we have, we're going to walk over to the borescope and inspect them. Be right back, guys. All right, so here we go. I'm using my small fiber optic borescope here, because some of those cannulas are extremely small. So just looking down there, making sure that they're clean, and I'm grabbing each one by one. So that was a question I had posed not too long ago. If you use a borescope, do you look down every single cannulated item, or do you just randomly pick one or two cannulated items and look down and assume that all the other ones are clean? Well, if you have the tools, use them, guys. I say look down every cannulated device with this borescope to ensure that it's verified completely that they are clean and there's no defects, because it's going to be that one item you don't look down that's going to be soiled or damaged or whatever that you didn't decide to use the borescope for. Okay, just go ahead and inspect these lumens. We can do the physical inspection when we get to our workstation, right? So I'm just looking down these cannulas, making sure that they're nice and clean, free of debris. And unfortunately, this, again, I don't have this fiber optic borescope hooked up to a video camera yet, but that's in the works. I'm working on that. And right now, I just got to put my eye to it. Okay, in the stretch here, I'm almost done here, guys. So again, still looking down these cannulas, making sure. Okay, you see the light from the little borescope? They go right there, shooting right out the end right there. All right. Again, quality takes time, man. It does take time. It's not as simple as just dropping it on your lap and saying, oh, this is going to be real simple. It's going to make my job a lot easier. There's a learning curve that comes with it, right? So make sure that you take your time, question what you see, and be familiar with what you're seeing as well. All right? And sometimes when you have a little bit of moisture in there, it can, interfere with your visual in there, but don't worry about that. Just go ahead and keep it moving. Okay, that moisture will move out of the way, and you'll be able to see inside those cannulated devices. All right, so give me a second. I'm going to go get me a disinfectant wipe and wipe off my fiber optics cord here. Alright, so wiping off my fiber optics, got my gloves on. Okay, and I'm gonna be honest, guys. You know, I've worked with chemicals all of my life, and you know, I rarely wear gloves when I handle chemicals, but this is for the gram, right? This is for the camera. Guys, you should wear gloves when handling any kind of chemistry. Okay, and of course, once you take your gloves off, you should perform hand hygiene. All right, so wash your hands with soap and water, or you can use an alcohol-based wipe. I chose to wash my hands because I want to sing the ABCs 2 times, right? It's 20 seconds of hand washing. 20 seconds. And then effective drying. And then back to the drawing board, right? All right, here we go, guys. See you over at the workstation. All right, now we're back. Okay, so now I've inspected inside with the lumen. Now I'm going to inspect each one for exterior cleanliness. Now, could I have done that over there as well? I could have. I could have inspected the outside and then the inside, but because inspecting with the borescope takes so long, you just want to go in and out and check the outside, make sure that it's nice and clean. Now I'm checking each individual reamer right there. Checking for that cleanliness, checking for any damages. All right, and they look good. I mean, initially when I looked at them with the borescope, if they look good outside the way they, inside the way they did, most likely the outside is gonna look really good as well. So I wasn't too overly concerned. And as I stated, I had already inspected this tray prior to doing this video. So, all right, again, my little implants in there, go through them, make sure that they're nice and clean. And that brings up another topic with implants, and it's been talked about so many times. It's like, I don't really feel like I am like strongly opinionated about this, that we should not be reprocessing implants. Like, once this is opened up in the field with one patient, we should not be sending the implants back to decon to get cleaned. Now, of course, if it went into the patient, then of course that's discarded, but this set has been contaminated with that patient's body fluids. So it didn't physically touch the patient, but the scrub tech, whose hands are soiled with the patient's body fluids, has touched these implants. So technically, they're used and they're soiled with body fluid. So they should be discarded, but ain't nobody doing that, right? All right, so I got my indicator on the top. Now, as I stated, I didn't place indicators in the modules because, again, those indicators can swell up in there and then make the top very difficult to come off. It'll jam things up, and worst case scenario, something happens and it breaks apart, and those particles are on the implants or in the reamers and things of that nature. So where do you put the indicators? On the very top of the tray and on top of the module of each level. All right, so we're going to close off our little compartment there. We're going to slap our lid on, and this tray is done, guys. Next thing I have to do is grab my label, grab my vendor tags, and then go off and wrap this up. All right, guys, so that's processing and loaner. One was dirty, one was clean, waiting for that dirty one to come on back, and you just repeat this process over and over again. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself. Until next time, peace.